Every cat owner is aware that their pet is unable to communicate when it is in pain. Therefore, as caretakers, we must learn to recognize the signs indicating our pet's suffering. Cats are animals that instinctively hide symptoms of pain. In the wild, showing signs of pain could make them an easy target for predators. Therefore, our domestic companions often do not let us know about their ailments. To help them, we need to know what a suffering cat looks like. Here are the 7 most common signals indicating that your cat needs immediate veterinary assistance. 1. Behavioral changes. Cats that start to fall ill often lose interest in their surroundings, isolate themselves, and spend much more time sleeping. The most typical symptom of withdrawal is avoiding contact with people and sleeping most of the day. Outdoor cats may leave home and not have the strength to return, which can be related to general weakness or specific health problems. Sudden aggression, such as reluctance to be stroked, unexpected biting, or fits of anger that were not previously present, can also indicate health problems, including urinary tract diseases, orthopedic pains, or neurological issues. 2. Changes in appetite. A total lack of appetite can be related to pain or abdominal discomfort caused by gastrointestinal diseases such as enteritis or pancreatitis. In younger cats, a lack of appetite may signal dangerous viral or bacterial diseases, such as panleukopenia or respiratory infections. In older cats, common kidney problems can also lead to reduced appetite, as toxins accumulating in the body due to renal failure can cause a feeling of malaise and lack of interest in food. Eating smaller amounts of food or suddenly walking away from the bowl during a meal can be a symptom of dental diseases or oral cavity problems, such as gingivitis or mouth ulcers. Selective eating, avoiding hard foods in favor of soft ones, can be a sign of stomach problems, often accompanied by vomiting. 3. Changes in defecation. Cats suffering from pain, especially in the lower parts of the body such as joints, spine, or muscles, may have difficulty entering and exiting the litter box, which can lead to avoiding it and defecating elsewhere. Problems with the urinary system, such as bladder infections or bladder stones, can cause frequent visits to the litter box and pain or discomfort during urination. 4. Change in grooming routine. Dull, tangled fur, lack of shine are symptoms that a cat is in pain or ill and neglects its routine grooming. The fur can become dull, tangled, or even matted, especially in hard-to-reach areas such as the back or around the tail. Healthy cat fur is usually shiny and smooth. Cats with health problems may have fur that seems dry and lacks luster. Excessive licking of affected body parts can lead to a lack of fur in these areas and even the formation of wounds. 5. Sudden weight loss. Many diseases can cause weight loss in cats. If a cat eats more than usual but still loses weight, it is most often a symptom of thyroid disease or the presence of parasites. In the absence of changes in appetite, weight loss can be related to pain, cancer, kidney failure, or liver disease. 6. Lameness, sudden paralysis. Lameness often occurs after cat fights. The limb may be swollen and warm. Not always a fracture is diagnosed, but the infection itself can cause pain and limping. In such cases, anti-inflammatory and pain-relieving medications are necessary, and sometimes an antibiotic is also recommended. Paralysis of the hind limbs is a very serious symptom. It can be related to spinal injury or thrombosis in the vessels, which is one of the symptoms of severe heart disease in cats. In such a case, an immediate visit to the veterinarian is necessary. 7. Cough, heavy breathing. Most often we observe a slight discharge from the nose and occasional sneezing, sometimes hoarseness. When cats have an upper respiratory tract infection, they often do not meow. Most cats rarely cough, but this does not mean they are not struggling with severe pneumonia. If a cat does not want to lie on its side, constantly sits on its paws, or has its head extended upwards and its mouth open, it means that it has difficulty breathing, and the condition is very serious. In such cases, immediate contact with a veterinarian is necessary. Remember, every cat is an individual and may react differently to pain or discomfort. That's why it's so important to know your cat and be aware of even the smallest changes in its behavior. Any doubts or uncertainties about the health of your cat should be consulted with a professional, such as a veterinarian. caring and being responsible for our furry friends is not just the pleasure of their company, but also the duty of looking after their well-being and health.